So hello everyone, myself Sashant from third year. So my topic is rheumatic fever. So we will firstly understand what's the rheumatic fever in the simplest term, right? So imagine you are having a sore throat, right? And from the germ called strep bacteria, right? Then if the strep bacteria persists and the germ doesn't go away, then your body's immune system gets confused, right? And if it gets confused, then it accidentally starting to attack your own body, like body parts like heart, joints, and even brain. Then it will make you feel tired, itchy, and if this persists, then this diagnosis is known as rheumatic fever. Okay, so rheumatic fever, it's an autoimmune inflammatory disease that can develop after a untreated and poorly treated group A staph infections. Okay, and it actually mostly occurs in the age group of the children 5 to 15 years mostly, and it can lead to the various serious complications also, mainly to the heart, right? Okay, that's why it is also known as rheumatic heart disease. Okay, so for the rheumatic fever, there is a Jones criteria. Okay, Jones criteria is for the symptoms mainly, like how there is a symptoms follow up. So in Jones criteria, first of all, the carditis. In carditis, there is an inflammation of the heart, and it can cause the murmur, and on the later stages, it can cause the heart failure also. And the second one is migratory polyarthritis. In migratory polyarthritis, there is a swollen joints and painful like movement of the joint stiffness and all. Then the acidenum scoria. In the acidenum scoria, there is a involuntary jerky movements, right? And then the next one is erythema marginatum. It is a skin clinical finding, as you all know. And in this, a special ring-shaped skin rash is seen. And then a subcutaneous nodules is there, a small lumps under the skin. Mostly it is painless, but in some cases, some people do like find it painful. And the minor criteria for this also, rheumatic fever is like fever as general, and arthalgia, and then elevated ESR, then prolonged PR interval on the ECG is seen. Then if the main thing, if there is an evidence of the recurrent occurring group A strep infections, like positive throat culture, and then elevated ASO titers, by these things we can know there is a prominent finding of the rheumatic fever by the recurrent infections of the group A strep infections. Then the complication can occur like in a rheumatic heart disease, the mitral valve damage can occur, heart failure. And then for the treatment, mainly antibiotics are used to clear up the strep infections. Then anti-inflammatory meds like aspirin and steroids for carditis is used. Then long-term penicillin prophylaxis to prevent the reoccurrence of the group A strep infections is used.